Good morning, and thank you for joining me today. Today is Rosh Hashanah, literally meaning the head of the year, which is the Jewish New Year. It is a time of inner renewal and divine atonement. This year, Rosh Hashanah began at sundown last evening and ends at sundown either tonight or tomorrow, depending on how it's observed. So we want to wish a happy new year to all of our Jewish friends and neighbors. This week is also National Suicide Prevention Week, which is an annual week-long campaign in the United States to inform and engage health professionals and the public input about suicide prevention and warning signs of suicide. Suicide is the 10th leading cause of death in the United States. In 2019, 47,511 Americans died by suicide, and in 2019, there were more than an estimated 1.38 million suicide attempts. 1.38 million. Certainly, we all know that there's been enough stress, struggle, and trouble to last a lifetime. And we know that it's not easy. We know that it's absolutely normal to feel stressed and overwhelmed about all that's going on and with all of the bad news that we hear on a daily basis. To our citizens, our friends, we want you to know that you are not alone in feeling this way. We want you to know that we care about you, and we want you to know that we want to help. If you or someone you know or love has considered suicide, they mention the word suicide or hurting themselves or ending it all or doing something different, there is help available. The National Suicide Prevention Lifeline is a United States-based suicide prevention network of over 160 crisis centers that provide 24/7 service via toll-free hotline. And that number is 1-800-273-8255. 1-800-273-8255. And we want you to write that number down. We want you to have it. It may not happen during National Suicide Prevention Week, but at any time, there is help available. So if it's available to anyone that's in suicidal crisis or emotional distress, we'd rather be safe than sorry. Let us be of help to you. I visited New York this weekend to check on my parents and my family after the devastation that Tropical Storm Ida caused to the New York, New Jersey, and Pennsylvania areas. While my parents are fine, it's evident that many parts of the tri-state area are not. And I spent considerable time this weekend looking at and evaluating this event through a Savannah lens. I am particularly interested that this storm, initially thought of as a heavy rain event, resulted in the wettest hour in New York City history, according to the National Weather Service, and that a flash flood emergency was issued, the first in the city's history. On August the 21st, due to the remnants of Hurricane Henri, New York City's Central Park saw a rainfall of 1.94 inches in an hour, 1.94 inches. And that was, at the time, the most rain per hour event in New York City's record-keeping history. On Wednesday night, however, September the 1st, 3.15 inches fell in 1 hour, shattering that record. Now, why is this relevant? For starters, because regardless of where your views fall on the whole climate change, global warming spectrum, our storms have absolutely become more frequent, more violent, more deadly, more costly, and for a coastal city like Savannah, that's extremely important to us. Secondly, we know that the peak of our hurricane season starts on about September 10th, which is this week. And although we were blessed to be spared last year, this year brings about new challenges particularly around COVID, that must be considered. As a low-lying land city, Savannah can be just as much risk from a tropical storm with heavy rain over a short period of time as we can be during a Category 1 hurricane. I will be asking the city manager to coordinate with our emergency management team and our partners at Chatham Emergency Management to evaluate our flash flood emergency plan. An assessment of our ditches, our catch basins, our culverts, our drainage systems, particularly in those areas that are known to flood. We also need to consider a downed tree task force along with detailed and dedicated inspections and patrols to assess rising waters. We know that in heavy rain events, there are areas that are going to flood. We need to close those streets before they flood. It just makes sense. We know heavy rain is coming, close the streets. Let's stop the opportunity for somebody to try it and get their car stuck. And we know those places because we always see cars there, stuck. So we also need to make sure we have the right equipment. We need to make sure we have chainsaws and hand tools. We need to make sure we have pumps and generators, water rafts, and other appropriate rescue equipment to be able to get to people if we needed to. We also need to make sure we have a clear means of communication with those in flood-prone areas. Since we already know who they are, we need to communicate with them. And we need to consider pre-drafting messaging regarding potential dangers for flood-prone areas to be used in outreach and notification in advance of forecasted extreme rain events. We know who these people are. We know how to contact them. We know a heavy rain event is coming. We need to contact them in advance. So again, I ask that Savannahans, in advance of the potentially most active period in our annual hurricane season, to make sure that you have a plan. Make sure you know where you're going to go. Make sure you know what you're going to do. Make sure you know where your medications are. Make sure you know where your important documents are. Make sure that you have your important family heirlooms in a safe place. You have to also make sure you communicate with your family. You have to make sure that you inventory your belongings, because obviously it's easier when you know what you have, so that way you know what is lost. Make sure you have insurance. Insurance is important. And make sure you have the right amount and the right type of insurance for your individual situation. If you can secure flood insurance, please do so. Please make sure you do so. If you are a renter, make sure you get renter's insurance, which I understand is affordable and widely available. Please do not wait until the last minute, because you may not be able to get the insurance you need. So that's my cautionary tale for today. It certainly appeared that everyone enjoyed the long weekend, and not necessarily safely. Folks have sent me pictures and videos of people just turning up in Savannah. Very few masks, unfortunately. We look at football games across the country, people in small spaces, people having a good time, no mask, very little social distancing. So it is what it is. We will see in 2 weeks what the unofficial end of summer did to our COVID metrics here in Savannah. In Chatham County, our 7-day rolling average of new cases still sits at around 270 after peaking at 306.1 last week. At the end of last week, we recorded 1,391 COVID cases for every 100,000 residents, just shy of a record community transmission index of 1397 recorded the week before. About 52% of Chatham County residents have had at least one dose of the COVID-19 vaccine, and about 46% are fully vaccinated. Again, just a note from our weekend, New York, New Jersey, Connecticut are over 80% with at least one dose. So there you're seeing businesses opening, you're seeing businesses requiring vaccination cards to get into the establishments. but you also see very high vaccination rates. If you have not already, please get your COVID vaccine. The Coastal Health District is hosting pop-up clinics around the city, and you can find the full list and make an appointment at gachd.org/vaccine. gachd.org/vaccine. Walk-ins are also welcome. Vaccines are also widely available at pharmacies, health clinics, and doctors' offices. Utility payment assistance is available for City of Savannah utility customers with unpaid balances. Anyone with an outstanding bill is encouraged to apply for assistance as soon as possible to ensure that there are no service interruptions, as the city's Utility Services Department resumes normal business operations this month. The state of Georgia's rental assistance program is also available to pay past due utilities and rent. For more information and to apply, visit georgiarentalassistance.ga.gov, georgiarentalassistance.ga.gov, or call 1-833-827-7368, 833-827-7368. The Economic Opportunity Authority is distributing funds available through the Emergency Rental Assistance Program to eligible households. For more information and to apply, call 912-238-2960. You can also reach out via email, and all of the email addresses are listed in the top story section of SavannahGA.gov, the award-winning SavannahGA.gov. City bill payment plans are also available, and customers interested in setting up a new payment arrangement should contact Utility Services at 912-651-6460, Monday through Friday from 8:15 a.m. to 5 o'clock p.m. And we recognize and understand that there's a lot of people calling in, so wait times might be a little long, so we're asking people to be patient. In July, Utility Services began mailing customers with unpaid balances to notify them about regular collection activities resuming in September. So we're in September, and we're going to start resuming our regular activities. Customers have 30 days to pay their bill without penalty, and then additional fees are assessed beginning on day 31. Payments can be made online at savannahga.gov/utility-pay, savannahga.gov/utility-pay, or in person at 305 Farm Street. The ARCS, or Advocates for Restorative Communities in Savannah's task force, will host the When is the Debt Paid conference for those with criminal histories on September the 25th from 8:30 a.m. to 2:30 p.m. in the Armstrong Center Ballroom, 13040 Abercorn Street in Savannah. The conference is free, but you must register by September the 20th to attend. Please call 912-344-3602 to reserve your spot, 912-344-3602. The Friends of Foresight and the City of Savannah will introduce the draft of the Foresight Park Master Plan next Tuesday, September the 14th. This draft is rooted in 11 months of community engagement, more than 4,500 completed surveys, and hundreds of written comments from our community. There will be virtual and in-person opportunities to share comments and feedback, and details can be found on the homepage of, again, our award-winning SavannahGA.gov. For additional information, you can contact the Friends of Foresight at friendsofforesightpark@gmail.com, friendsofforesightpark@gmail.com, or 912-441-8851, 912-441-8851. This weekend, Savannah will join the rest of the country in commemorating the 20th anniversary of September 11th, a series of 4 coordinated attacks on the United States in what is the deadliest terrorist attack in world history. 2,996 people died, including 340 firefighters, 72 law enforcement officers, 55 military, and those representing over 90 countries. Over 6,000 people were injured on that day, and many more suffered and are suffering from trauma and after effects of that awful day. We all remember exactly where we were and what we were doing, and our lives changed as we knew it forever. Saturday, September the 11th, is known as Patriots Day, and I'm asking all Savannahans to appropriately and intentionally do something significant to observe this day. Further, Sunday, I will be declaring September the 12th as Savannah Day. Savannah, September the 12th, 9/1/2. And I'm asking all Savannahans to do something special to show love for the place we all love and the place we are blessed to call home. So in advance, happy 9/1 Day to everybody out there. Finally, this week we will officially welcome our new city manager, Jay Melder, to the City of Savannah organization on Friday. We are excited to have him leading our team and eager to begin working with him. That being said, I have to thank Heath Lloyd for his timely and courageous leadership over the last couple of weeks. He is and remains a critical asset to our organization, and I want him to know personally I appreciate him, and we are looking forward to him being our franchise player in this government for the time to come. And so Heath, thank you so much for all that you've done, and thank you for dealing with my craziness over the last couple of weeks. So that is my prepared remarks. I'll entertain any questions you may have. And Lashana Tova.
Good morning, Mr. Mayor.
Good morning.
I wanted to ask about, 45 bus drivers of the school district called out today. They're protesting, and I know the city doesn't, directly, they're not in charge of the school district. But
So why are you asking me?
I'm curious to know your thoughts.
Why are you asking me? I mean, I don't know. I think, it's two ends. I actually saw Dr. Levette this morning. In the end, it's two ways. I mean, I think that if we care about kids, we don't leave kids on the street. Because obviously, if kids are coming to bus stops expecting to be picked up and no one picks them up, then the child is out there on the street. On the other end, I think that the bus drivers have some concerns that deserve attention, deserves conversation. And so I'm just hoping, and I'm confident that Dr. Buck, Dr. Levette, and the good folks in the school system and the bus drivers can work it all out. I mean, I'm not exactly sure about what all of the details are, but obviously it does affect us somewhat because in the end, we have parents that come to work, believing that their children are going to be picked up and they're not. So, I just hope they can work it out. We have to work through this. And so if the drivers are requesting something that is reasonable and within the wheelhouse of the school system to do, then let's try to do it. And then likewise, we need to get those drivers on the street. We're already short on drivers as it is. This is nationwide. Drivers, just short of the bus drivers. So we need to make sure that our kids are safe. So I'm hoping they can work it out.
And then with this plan that you have for, stores about trying to get ahead of, those flash flooding zones, you mentioned preemptively blocking off streets that flood and a tree task force. Are there any other areas specifically that you're hoping to see through this partnership with CMS?
Well, drains. I mean, for us, our issue is drains. City manager will tell you, our chagrin is that you have people sometimes that they cut grass and they take the grass and they blow it down into the storm drains. Okay, well, it's expedient then, but when it rains, that same, the cuttings now clog up the drain. And so now the streets don't drain as quickly. So what I'm ultimately asking the city manager to do is, first of all, we need an assessment of those drains. We know where the low-lying areas are. Let's send somebody out there now and let's clean those drains out. Also, we know that for us, our ditches are waterways, and that's how water moves. So obviously, if it's highly vegetated, water doesn't move. Let's get people out there now. If we have to contract, let's get it cut down so that water can move. Oftentimes, sometimes our issue, and I believe it was Heath that might have taught me this, was the issue is not necessarily the amount of water, it's sometimes the water conveyance. If water can't move, then it backs up and then it drains. So that's the issue. So our goal is, we know that we are prone to flooding. So then let us go ahead now. Let's clean these drains. Let's clean these culverts. Let's cut these ditches. Let's do it in a very intentional, quick way, because we know that the next month and a half or so are going to be really interesting for us. So let's do this ahead of time. I think what I saw in New York was that they were just caught really off guard. I mean, they never had a flash flood alert ever. And this amount of rain was just falling, and before you knew it, I mean, you talk about 7, 8 inches of rain that are now in people's basements, that are now rising up. And so I'm saying that when you know better, you do better. And I think it was an eye-opener for me that we just have to be more proactive, because we're worried about hurricanes, but in this case, there was no evacuation order. It was just rain. Quote, I mean, I've lived through hurricanes in New York. I've lived through rain events in New York. They come and they go. This one came and sat. And like I said, 3 inches of rain in an hour period. I want them to look at that. If it rained 3 inches an hour here in Savannah, what does that mean for us? If it was 3 inches at high tide, what does that mean for us? And so I just think that there are things that we can do. And I'm just asking that if we need to, I think it's cheaper and more effective for us to deal with at the front end and do it now than deal with the tragedies of water not being able to move. So
with the down tree task force, who do you envision making that up?
City manager determine that. Again, I mean, part of the issue, again, for what I observed in New York, was that some trees came down. And you couldn't get to people because the trees were down. People were in streets you couldn't get across because if a tree was down, now all of a sudden you're stuck. So, I mean, let's make sure, again, we have over 80,000 trees here. So we know we're a tree town. And so if something occurs, if a tree falls, if it falls over a house, or if it falls really more so in a roadway, we're trying to get emergency crews through. If the ambulance needs to get through but can't get down because of a fallen tree, we need to have a task force, again, of however the city manager determines. But let's get that tree cut. Let's get it moved out the way so that we can get emergency travel back and forth.
And then last question for me. I don't know if there was an update as far as the city employee COVID incentive program that you can provide for us.
Have you all met? So they've met, but there's no detail this time. They're still working through it. We're hoping to get that done soon.
This is our new reporter, Destiny.
Okay. Our new reporter, Destiny.
Hi. So you mentioned that in 2 weeks you will start to see where COVID-19 falls in Savannah after Labor Day. So what specific data or COVID information are you going to look at to determine where Savannah stays with potential COVID-19 restrictions?
Sure. Our community transmission index. Our new infections, our positive test percentage, hospitalizations are generally the things we look at, and then our vaccination rate.
Okay, so you mentioned that people were out celebrating unsafely.
Turning up.
Right. So what would be your perception or thoughts or things that you want to say to civilians about potentially moving forward and after these next 2 weeks? What is something that you want them to be aware of?
I mean, I think I've said it on multiple occasions. At the end of the day, our actions now dictate what happens to us in the coming weeks. You know, on one end of it, you know, we see pictures, we see videos of people, young people and older people, you know, in public spaces, very close proximity, no mask, but then we're wondering why our positivity rate in our schools are up. Well, if parents are not vaccinated or acting responsibly, then obviously they go home, their children catch it. So, I mean, again, we just got to decide as a community what it is we want to be able to do. You know, I just think that, you know, I was concerned about how that would all turn out. You know, at this point now, you know, we're just going on the numbers. So we're looking.
Good morning.
Good morning, sir.
Do you know roughly how many visitors came through Savannah over the weekend?
No idea. I will tell you that our hotels did extremely well. Businesses have been reporting organically that it was a busy weekend, and you could just see people all over the place. That's kind of our indicator of just seeing people. I think that the other indicator, when I came into the airport was packed. So that's another indicator that we were doing pretty well this weekend.
Sure. And so a couple weeks ago when we announced the permit applications for those events, you also mentioned the city stepping up mask enforcement on buses. I was wondering if there's any update on any citations that have been given out so far.
I mentioned the city stepping up mask enforcement on trolleys. So yeah, so not buses, it's a different thing. So I do not have any information about that, but we'll find out.
Thank you.
Mm-hmm.
Morning, sir.
Good morning. You and Nick kind of coordinating?
We did. Actually, I was wearing it first.
We talked about it this morning.
Okay.
Want to ask you really quick about the vaccination rate among city employees. I know you touched on the incentive program. Still hashing that out. Where are we in terms of numbers?
Well, two things. First of all, September 1st, we had an incentive program with time off for employees that ended September the 1st. And so we're in between the two programs. I think our vaccination rate for our employees remains relatively unchanged.
We actually, it's about 50%. We had some positive stuff saying should we can put on an event last Friday.
Okay.
Our employees participated, so we're about right around 49
to 50%. We're about 49 to 50%.
And one other thing that I haven't touched on for about a month and a half or so, the Parklet study, is that still moving along, and can we see that program come back in some sense?
Yes, I think, again, very clearly, the Parklet program was instituted as an emergency initiative under an emergency mandate. It was something that we tried to attempt to help businesses that were affected by state-imposed capacity limits. It was a big hit, but it wasn't a big hit for everyone. When the governor released the capacity limits in May, the city of Savannah kept the Parklets in place for another 2 months. And although the businesses that had the Parklets were getting city space that they were not paying for, we understood it, we got it, we're team players, we worked along with them. Now it is time for us. And then it is inappropriate for us to have an emergency condition when emergency conditions don't exist anymore. So in other words, we put that in during the emergency. As of July, there were no emergency conditions, so we needed to be full. So now I think we're satisfied that the program was successful enough that we need to evaluate it citywide. So that work is going on now. It's our expectation that that will be ready by the beginning of the year. And the issue is people say, well, just do it now. Well, you don't just do it now. I mean, it has to be evaluated citywide, first of all. Secondly, there has to be rules associated with that. There has to be some design standards about how we would expect for parklets to be maintained. Then there has to be a fee assessed because, as you know, parking is very valuable. It's a premium. That's a cost to the city, and we need to be able to recover that cost. And so since that would also have to be part of the revenue ordinance, so therefore we amend the revenue ordinance annually, so we expect that to be a part of the budget negotiations. When we adopt the budget and the revenue ordinance, we'll have an application period where people can apply. I think the other thing is you have to have zones where, some areas you can do it easily, some areas you can't. But I think that has to be evaluated citywide. Again, I think it was a good program. I think people were maybe upset that it went away, but the reality was it was an emergency condition for emergency conditions.
Well, some might make the argument that even though we're not under those official emergency orders, that we're at levels right now of COVID cases and community transmission, that we're right back where we were when those emergency orders are in place. So is there any way that it could be expedited?
It could be expedited in the event that we go to capacity limits. So, I mean, again, the emergency conditions were there, but we were not reducing capacity. So, I mean, you can't have it both ways. So on one end of it, I mean, yeah, we could go to a Parklet program now under an emergency condition. On the second side of it, we're going to reduce capacity. But see, again, it works for the few. It doesn't work for the whole, because there are some businesses that cannot take advantage of it just because of where they're situated. They might be on a busy thoroughfare, may not be any parking there. There might be more than one restaurant on a street. So then who gets the parklet? So again, I think for us, we have to be fair about this. And the strangest part about it, although some people complain, the complaints we got about people saying that we need to be fair about it was from other businesses, saying, well, hey, wait a minute, we want free city parking too. They get it, and it was a good point. But I think, I feel comfortable in the fact that, again, capacity limits were established by the governor. We were working along with people to help them to keep their head above water. It worked, and then we allowed them to have an extra 2 months. So, I'm confident now that we can move forward with a program that is permanently instituted within our revenue ordinance. But, I think on the other end, if we move to reduce capacity, and we could very well do that, then, parklets are back on the table.
2 seconds.
Good morning. Is it the same one?
Possibly.
Okay.
Oh, goodness. All right. Whoop. Yeah, I'll have to get you a sidebar on this one for a second. It's going to take me minutes to read through that.
Tell her next time I want her to come down.
That's fair. So again, revisiting, this is the last thing for me, sir. In a couple of weeks, looking at the possibility of permit revocations in October and November, that's when it's going to be reevaluated?
Yes, we expect within the next 2 weeks, I'll be meeting again with the medical advisory team, and we'll be looking at the numbers, and then we'll go from there. It's two-sided. One side is that we want to give more than adequate notice to event planners that this is occurring, so they have enough time to cancel events or postpone events. We are telling everyone, be prepared to go virtual. For things that can go virtual, be prepared to go virtual in the event that happens. Then also for people who might be traveling here, we want to make sure they have enough time to cancel the hotel and plane reservations as well. So October is admittedly a very busy month for us. And again, I would hate to have to go there, but if our numbers don't improve, I think we have no other choice.
Thank you, sir.
Thank you. Anything else? Okay. All right, well, ladies and gentlemen, grateful for a relatively short week. We'll see how it goes. We have a council meeting on Thursday. We're going to have an update by Dr. Davis to council on that day. So council will be able to hear directly from our coastal health director about what's happening in our city. So thank you for all you do. May God bless you. May God bless the city of Savannah and the Chatham County.